Well, the number of coronavirus cases in the U.S. have surpassed a grim milestone, topping 4 million yesterday. Florida recorded its record number of deaths in a single day. That's 73 people. That state just behind California and New York in total number of cases now. Meantime, President Trump canceling part of the Republican National Convention that was scheduled to be held in Jacksonville, Florida, because of virus concerns. I want to bring in Dr. Alister Martin. He's an ER physician and faculty Center for Social Justice at Harvard Medical Center or Medical School. And Doctor, appreciate your time today. I'd love to start with what we heard from a lot of health experts earlier this week. They penned a letter directed at lawmakers in Washington, saying essentially it's time for a reset, that things need to be shut down right now and restarted because of how far the virus has spread. Is that where we are right now?
Kiko, we passed that new grim milestone of 4 million cases, and it's not just that we're testing more. It's not just that we're finding more folks who are positive. We also have the 6th highest mortality rate in the entire country, entire world, behind the United Kingdom, places like Spain, Italy, Chile, and France. And the bottom line here is that we don't have this virus under control right now. We're seeing widespread death across the country, and most importantly, disproportionately among communities of color. Folks who are Black and brown have a much higher rate. You compare, for example, the rate of death among Black folks in this country, 3.7 times higher than the rate among the white population in the country. So we've got a lot of work to do to not only capture this virus, get this under control, but also re-examine our healthcare disparities in this country to figure out why we have such disproportionate numbers of deaths.
What does getting the virus under control entail, though? I mean, do we need to have a complete shutdown again? Does that need to be on the table, or are we starting to see the impact of these additional restrictions that have been put in place in some of these hot spots?
It's a great question. I think that there are a couple really important things that we can do to get this virus under control. The first is we have to each individually really take seriously the precautions, the social distancing, the mask wearing, the limiting of small gatherings. It actually does start with us as individuals. Yes, the federal government, yes, the state governments have some role to play in this to really sort of create a holding environment or holding space to allow us to, as individuals, step up and do what we can. From the government perspective, from the state and federal government perspective, we need far more expanded test, trace, and isolation procedures. What we have now is what you'll see across the country is a relatively paltry process of rolling out testing across the country. And we're already seeing testing really come under serious strain. So we've got a lot of work to do if we want to get to a place where we get this virus under control.
Doctor, we got the CDC out with its guidelines for schools today, suggesting that children may be at lower risk of getting COVID than adults. Specifically, the CDC pointed to what's been playing out in other countries like Denmark or like Taiwan. Is that a fair argument to make here when you consider the resources that are in place in some of those schools we've seen abroad and those in public schools here in the US?
Well, the CDC guidelines, some would interpret as them coming down hard in favor of reopening schools based on some of that data that you mentioned out of Europe. I think the thing to remember is that the CDC also recommended that local officials consider closing schools or keeping them closed if there's substantial or uncontrolled virus in the local or regional districts where these schools are. And so, look, this is a complex issue. The bottom line is, if we want schools to reopen in the fall, we've got to act like we want schools to reopen in the fall. We've got to do what we can to wear those masks, do the social distancing, limit large gatherings. Otherwise, we will not only jeopardize our children, but the caretakers, the family members, and the teachers who care for our kids.
In addition to being an ER physician, you have an organization that helps mobilize health workers to vote. As we look to the upcoming elections, particularly November, how comfortable or how concerned are you about the impact on the vote, on the election, if voters don't feel comfortable enough to go out?
I'm incredibly concerned. And, Akiko, for the first time in our history, I think voting really has become a public health issue. We've already seen a 70% decrease in voter registrations on the year because places like DMVs and RMVs are closed. Tabling events aren't happening where folks normally get registered. And so you also look at the election officials whose average age is 60 and higher in this country. And those are the exact individuals we don't want, interacting in large groups like a polling place. And so I am concerned. I'm also hopeful, though. We're seeing healthcare providers all around this country step up. We're seeing health institutions step up to offer voter registration in healthcare settings while folks are waiting. It's an idea whose time has come. And in August, over 80 hospitals and 50 organizations have come together to put together National Civic Health Month to help folks vote in a safe and healthy way this coming November.
Okay, Dr. Alister Martin, appreciate your time today. Some good takeaways for us there as we continue to track the latest on the coronavirus.